Imagine you're 64, 68, or 72. You wake up one morning and realize something you haven't talked about. It has been weeks since you last ejaculated. Maybe you stopped having sex. Maybe masturbation became less important. Your interest in sex has faded, or your erections aren't as frequent as they once were, and maybe you've told yourself, I'm over 60. Maybe this is normal. But then another thought appears. If you stop ejaculating after 60, does anything happen inside your body? Does sperm build up? Does testosterone change? Does the prostate become affected? Could your sexual function become weaker because you're not using it? Or is your body simply adjusting to a different stage of life? These are questions, and if you've wondered about them, you're not alone. Sexual changes after 60 are common, but they don't look the same for every man. One man chooses to stop sexual activity and feel comfortable with that decision. Another may still want intimacy, but struggle to get or maintain an erection. Someone else may become aroused and reach orgasm, yet have difficulty ejaculating. Sometimes a medication or health condition is influencing what happens. That's why the question isn't simply, how often should a man ejaculate? It's, why did the change happen? That distinction matters. Aging can change sexual response. Erections may take longer. Desire can fluctuate. Ejaculation may become less frequent or feel different. But getting older does not automatically mean sexual function has to disappear. And here's where this gets interesting. Something that feels like a sexual problem can be a clue about another part of your health. In this video, we'll look at what may happen to sperm, testosterone, the prostate, erections, and sexual desire when ejaculation becomes infrequent. We'll also separate normal changes from signs worth discussing with a doctor. The goal is not to make you worried. It's to help you understand your body without embarrassment. So before we talk about the reproductive system, we need to clear up the assumption about what happens to sperm when ejaculation stops. One of the biggest worries men have about stopping ejaculation is, if nothing is coming out, where does it all go? It can sound logical to imagine the reproductive system like a container. Sperm keeps being produced, semen keeps collecting, and eventually the body must somehow get rid of the excess. But that isn't how your body works. Think of the male reproductive system less like a storage tank and more like a recycling system. Sperm are produced continuously during much of adult life, although sperm production and quality can change with age. Those sperm cells don't live forever. As they age, the body has natural ways of breaking them down and reabsorbing their components. In other words, unused sperm don't just sit there indefinitely filling you up. Your body is constantly managing the process. This is important because many men hear claims that they need to ejaculate regularly to clean out their system. There is no medically established ejaculation schedule that every man needs to follow for that purpose. If you go through a period without sexual activity or masturbation, your body does not suddenly become overwhelmed with stored semen. And sometimes, the reproductive system may release fluid or sperm without sexual activity. Some men experience ejaculation during sleep. These episodes are generally more common in younger men and become less common with age, but they can still happen. Now, that doesn't mean nothing changes when ejaculation becomes less frequent. The amount and characteristics of semen can change with age. Sperm production can change too. The prostate and other reproductive glands also change over the years, but those changes are not the same thing as dangerous buildup. So if you've gone months without ejaculating, you don't need to imagine your body as a pressure cooker waiting to explode. There is no evidence that semen keeps accumulating until something bursts. That's the reassuring part. But here's where the story becomes more interesting. If your body can handle sperm and reproductive fluids without regular ejaculation, why might some men notice changes in their erections, sexual desire, or ability to ejaculate when sexual activity decreases? That question matters because not ejaculating and being unable to ejaculate are two very different situations. And once we separate those two, the real reasons behind sexual changes after 60 become much easier to understand. When a man says, I haven't ejaculated in months, there is an important question that comes before almost everything else. Did he choose not to, or is he trying and unable to? Those two situations can look identical from the outside, but medically they can tell very different stories. Imagine two 65-year-old men. Neither has ejaculated for 6 months. The first simply isn't sexually active anymore. He doesn't masturbate, he isn't particularly interested in sexual activity, and he has no pain or other symptoms. He's comfortable with the change. The second man is very different. He still has sexual desire. he becomes aroused, but ejaculation takes an unusually long time, sensation feels different, or orgasm has become difficult or impossible. Both men can say, "I stopped ejaculating." But that sentence doesn't tell us why. This distinction is important because not every change should automatically be blamed on aging. Sometimes a man can still have an orgasm, but notice that little or no semen comes out. This may be described as a dry orgasm. One possible explanation is retrograde ejaculation, where semen moves backward into the bladder instead of leaving through the penis. Certain medications, previous prostate or bladder procedures, nerve-related problems, and some medical conditions can contribute to this. That does not mean a dry orgasm is automatically dangerous. The meaning depends on the person's symptoms, medical history, medications, and what changed. Then there's another situation. The problem isn't ejaculation alone. A man may notice that his sexual desire has dropped, erections are less reliable, and orgasm or ejaculation has also changed. Now we need to widen the lens. Sexual function depends on several systems working together. Healthy blood vessels help produce an erection. Nerves carry signals between the brain and reproductive organs. Hormones influence desire and sexual response. Medications can affect any part of this process. Sleep, stress, mood, and relationship changes can matter too. Conditions such as diabetes and cardiovascular disease may also affect sexual function, particularly when blood vessels or nerves are involved. So don't treat no ejaculation as one single condition. Instead, ask a better question. What changed? When did it change? And what else changed at the same time? That simple shift can prevent unnecessary worry while also helping you recognize something that deserves medical attention. And that distinction becomes even more important when we look at what happens inside the reproductive system itself. Now that we know the difference, let's look at what the body may actually do during a long period without ejaculation. So, if ejaculation becomes infrequent, what is actually happening inside your body? This is where it helps to slow down and separate several processes that are often treated as if they were one. First, sperm production. The testes can continue producing sperm throughout much of adult life, although production, sperm count, movement, and quality can change with age. But if you are not ejaculating, that does not mean sperm simply keeps piling up forever. Older sperm cells are naturally broken down, and their components can be reabsorbed by the body. Now consider semen. Semen is not the same thing as sperm. Sperm are reproductive cells, while semen is the fluid that carries them. Semen is produced using secretions from several glands, including the prostate and seminal vesicles. The amount and characteristics of these fluids can change with age, health, medications, and other factors. Then we come to testosterone, where there is a lot of misinformation. You may have heard that avoiding ejaculation causes testosterone to rise dramatically and stay high. That's not something you should assume. Research does not establish that simply stopping ejaculation produces a reliable, sustained testosterone increase. Testosterone naturally changes with age, and sexual desire depends on far more than one hormone. In fact, libido, or sexual desire, can be influenced by sleep, stress, mood, medications, chronic illness, relationship circumstances, and overall physical health. So if your interest in sex changes, it doesn't automatically mean your testosterone has suddenly fallen, or that ejaculation would somehow fix it. Now, let's talk about erections. This is another area where men can easily become confused because desire, arousal, erection, orgasm, and ejaculation are related, but they are not identical. You can have sexual desire without getting a firm erection. You can have an erection without ejaculating. You can experience orgasm with little or no semen. And a change in one of these functions does not necessarily mean every other part of your sexual system is failing. Think about sexual function like a car with several systems working together. Desire is like the ignition. Blood flow is like fuel delivery. Nerves are like the electrical wiring. The erection is part of the engine response. Ejaculation is another system that operates later in the process. If one system changes, the others may still work. That's why a man who isn't ejaculating should not immediately conclude that his body is shutting down. The real question is whether anything else has changed: his desire, erections, sensation, urinary function, medications, energy, or general health. And this gives us a much clearer way to understand sexual changes after 60. Instead of asking whether your body is simply running out of sexual function, we can look at each system and see what may be influencing it. This distinction matters especially for the prostate. But there is one organ many men immediately think about when they hear this topic, the prostate. And this is where some popular claims become much more complicated. When men hear about ejaculation after 60, one organ often comes to mind immediately, the prostate. You may have heard someone say you need to ejaculate regularly to keep your prostate healthy. You may even have seen claims that if you stop ejaculating, your prostate will become enlarged or unhealthy. But is that actually true? The answer is more complicated than a simple yes or no. Your prostate is a small gland located just below the bladder. One of its jobs is to contribute fluid to semen. As men get older, the prostate commonly changes. In particular, benign prostatic enlargement, often called BPH, becomes increasingly common with age. BPH is a non-cancerous enlargement of the prostate that can affect urination. But here's an important distinction. Prostate enlargement, urinary symptoms, and ejaculation are not the same thing. They involve nearby structures and can influence one another, but you should not assume that avoiding ejaculation automatically causes prostate disease. Researchers have studied whether ejaculation frequency might be associated with certain prostate outcomes. Some observational research has found interesting associations between more frequent ejaculation and a lower likelihood of being diagnosed with prostate cancer. But there's an important scientific limitation here. An association does not prove that one thing caused the other. In other words, if researchers notice that men who report more frequent ejaculation have a different prostate cancer risk, that doesn't automatically mean ejaculation itself is responsible. Other differences between those men could also contribute. That's why you should be cautious when you see an internet headline claiming that there is a magic number of ejaculations every month that every man needs for prostate protection. There is no universally established ejaculation schedule that doctors prescribe simply to keep a man's prostate healthy. So if you've gone weeks or months without ejaculating, don't panic. You don't need to assume you've damaged your prostate. At the same time, don't ignore a meaningful change in your health. For example, if you suddenly develop difficulty starting urination, a noticeably weaker stream, persistent pelvic discomfort, blood in your urine or semen, a significant unexplained change in ejaculation, or new sexual dysfunction, that's worth discussing with a healthcare professional. The goal is not to scare you into becoming sexually active. The goal is to pay attention to changes that may provide useful information about your health. And prostate cancer risk itself is influenced by multiple factors, including age, family history, and other individual characteristics, not simply how often a man ejaculates. So, forget the idea that your prostate is keeping score. What matters much more is the bigger picture. Because there is another reason a change in ejaculation after 60 deserves attention, and it has surprisingly little to do with semen itself. Sometimes the most important clue isn't what comes out or doesn't come out, but what changed everywhere else at the same time. Now we come to one of the most important parts of this conversation. Sometimes a change in ejaculation is simply a change in sexual activity. But sometimes sexual function can give you a clue that something else in the body deserves attention. That does not mean every erection problem is heart disease, or that every change in ejaculation means you have diabetes. It simply means sexual function depends on several systems throughout the body. Take erections, for example. An erection depends heavily on healthy blood flow. Blood vessels need to relax and allow enough blood to enter the penis. If blood vessels are affected by conditions such as high blood pressure, diabetes, smoking, or other cardiovascular risk factors, erectile function can sometimes change. This is one reason doctors may ask about sexual function during a broader health evaluation. But don't jump to the conclusion that an erection problem automatically means your heart is in danger. It doesn't. Sexual difficulties have many possible causes, and only a proper evaluation can help determine what's happening. Blood sugar is another piece of the puzzle. Over time, poorly controlled diabetes can affect both blood vessels and nerves. Those nerves help carry the signals involved in sexual sensation, arousal, and ejaculation. So a man who notices several changes at once may benefit from looking at his overall metabolic health rather than focusing only on ejaculation. Blood pressure matters too. High blood pressure can gradually affect blood vessel health. At the same time, some medications used to treat blood pressure and other common conditions can influence sexual function in certain men. And that brings us to medications. If your sexual function changed after starting a new medication, don't assume the problem is simply aging. Some antidepressants, certain blood pressure medicines, some prostate medications, and other drugs that affect the nervous system can influence libido, erections, sensation, or ejaculation. That doesn't mean you should stop taking a prescription on your own. Instead, make a list of your medications and discuss the timing of your symptoms with your doctor. Sometimes a different dose, medication, or treatment approach may be considered. Nerves are another important piece. Your brain, spinal cord, and peripheral nerves all participate in sexual response. Conditions that affect nerve function can sometimes change sensation or ejaculation. And then there are factors that aren't purely physical. Stress can reduce sexual desire. Anxiety can interfere with arousal. Depression can affect interest and sexual response. Relationship changes can alter intimacy. And after one disappointing sexual experience, a man may become anxious about the next one, creating a cycle where worry makes the problem even harder. Imagine a 67-year-old man who notices he hasn't ejaculated for several months. At first, he assumes it's simply because he's getting older, but during a medical evaluation, he realizes that his erections have also become less reliable, his energy has changed, and he's taking several medications. The lesson isn't that he should diagnose himself with a particular disease. The lesson is that a meaningful change deserves context. So instead of asking only, "Why can't I ejaculate?" ask, "What else has changed?" That question can reveal much more. And now we need to make this practical. How can you tell the difference between a harmless change and a warning sign worth discussing with your doctor? Most changes in sexual function after 60 are not emergencies. But there are certain changes you shouldn't simply dismiss by saying, "I'm getting older." The first is a sudden, unexplained change. If your sexual function has been relatively stable and then changes noticeably without an obvious reason, pay attention. A new change doesn't automatically mean something serious, but it gives you a reason to ask what might have changed. The second warning sign is persistent difficulty ejaculating, despite still having sexual desire. If you want to reach orgasm but repeatedly cannot, especially when this is new, it may be worth discussing with your doctor. Medication effects, nerve problems, previous procedures, and other factors can sometimes play a role. The third is pain. Pain during ejaculation, persistent pelvic discomfort, genital pain, or pain associated with urination should not simply be blamed on age. Pain is your body's way of telling you that something deserves attention. The fourth is blood. Seeing blood in semen can have several possible causes, and it is not always a sign of something dangerous. But blood in semen or urine should be discussed with a healthcare professional, particularly when it persists, returns, or occurs with other symptoms. The fifth warning sign involves your urination. Have you developed a weaker stream? Is it harder to start urinating? Are you waking up repeatedly during the night? Do you feel that your bladder isn't completely empty? Or have these symptoms suddenly become worse? These changes can have several causes, including prostate problems, and they deserve proper evaluation. The sixth sign is when sexual changes appear alongside other health changes. Maybe you're suddenly much more fatigued. Your exercise tolerance has dropped, you've experienced unexplained weight changes, or you've noticed other new symptoms at the same time. One symptom alone may mean very little. Several changes occurring together can provide a more useful clue. And then there's the seventh warning sign, which is easy to overlook because men often assume it has nothing to do with sexual health. A medication, medical treatment, or procedure changed everything. If your ejaculation, erections, sensation, or libido changed after starting a medication, changing a dose, or undergoing a prostate or bladder procedure, tell your doctor. Don't stop prescription medication on your own. Instead, ask whether the timing could be meaningful. Remember, these warning signs are not a diagnosis. They're simply reasons to pay closer attention. The goal isn't to make you anxious about every change. It's to help you recognize when your body may be giving you useful information. And now let's talk about one of the biggest mistakes men make after noticing these changes, and it can delay finding the real cause. After noticing a change in ejaculation or sexual function, it's easy to make assumptions. And unfortunately, some of those assumptions can lead you in the wrong direction. The first mistake is assuming every sexual change is simply aging. Yes, aging can change sexual response. Erections may take longer, desire may fluctuate, and ejaculation may become different, but that doesn't mean every new or sudden change should automatically be dismissed. Medications, diabetes, cardiovascular health, stress, sleep, and other conditions can also affect sexual function. The second mistake is chasing testosterone without getting evaluated. You may see advertisements promising that boosting testosterone will restore your sex drive or sexual performance. but low desire or erectile difficulties can have many possible causes. Testosterone is only one piece of the picture. If you're concerned about low testosterone, the better approach is to discuss your symptoms with a healthcare professional rather than assuming you need a hormone treatment. The third mistake is believing internet ejaculation schedules. You may hear that every man needs to ejaculate a certain number of times each week or month to protect his prostate, maintain testosterone, or prevent sexual problems. Be careful with claims like these. There is no universal number that every man needs to follow. Your age, health, medications, relationships, preferences, and sexual function are all individual. The fourth mistake is ignoring medications. A man may think, "Something must be wrong with me," when the timing of his symptoms actually points toward a medication effect. Some commonly prescribed drugs can influence libido, erections, orgasm, or ejaculation. That doesn't mean you should stop taking anything yourself. It means you should bring the change to your doctor's attention and ask whether your medications could be contributing. Ask a better question. Has anything changed in my sexual function, urinary health, energy, medications, or general health? Think of this as maintaining the infrastructure your body depends on. Healthy sexual function isn't separate from healthy circulation. Then look at sleep. Poor sleep can affect energy, mood, stress levels, and hormonal regulation. It can also reduce sexual desire in some people. If you're consistently exhausted during the day or regularly waking throughout the night, don't assume that's simply what happens after 60. Persistent sleep problems are worth discussing with a healthcare professional. Now, take a close look at your medications. If your sexual function changed after starting a medication or changing a dose, write down when the change occurred and bring that information to your doctor or pharmacist. Ask whether sexual side effects are possible and whether there are appropriate alternatives. But never stop a prescribed medication on your own. You don't need to chase a number simply because someone online says every man should ejaculate a certain number of times. Your goal should be healthy function, comfort, intimacy, and quality of life, not winning some imaginary monthly scorecard. After 60, taking care of your sexual health is really another way of taking care of your whole body. And this leads to perhaps the most important idea in the entire video. After 60, sexual health isn't measured by one bodily function. One of the most important things to understand about sexual health after 60 is that there isn't one definition of normal. Imagine two men who are both 68 years old. The first is still sexually active. He enjoys intimacy with his partner, has sexual desire, and continues to have erections and orgasms. The second has very little interest in sex. He doesn't masturbate, doesn't feel distressed about it, and is perfectly comfortable with his level of intimacy. Could both men be healthy? Absolutely. Sexual function varies enormously from person to person, and getting older doesn't suddenly create one standard that everyone has to meet. Some men remain sexually active well into their 70s and beyond. Others experience a gradual decline in sexual interest. Some notice that erections take longer to develop or require more stimulation. The time needed between sexual experiences may increase. Ejaculation may become less forceful or happen less often. These changes can occur as part of normal aging. The important word, however, is can. Normal doesn't mean that every change should automatically be ignored. Here's a simple way to think about it. If a change is stable, comfortable, and not accompanied by concerning symptoms, it may be less concerning. But if the change is new, persistent, unexplained, or happening alongside pain, urinary problems, blood, significant erectile changes, or other health symptoms, that's when it makes sense to talk with a healthcare professional. And there's another important question. Are you bothered by the change? If your sexual activity has decreased and you're completely comfortable with that, there may be no problem to solve. But if you want to remain sexually active and something is preventing you from doing so, you don't have to simply accept it as an unavoidable part of getting older. There may be an explanation worth exploring. So don't compare yourself with another man your age. Your sexual health isn't a competition, and there is no prize for having the most frequent sexual activity. The goal is to understand what's normal for you, recognize meaningful changes, and get help when something doesn't feel right. So if you remember only a few things from today's discussion, make them these. Before we finish, let's bring everything together. If you've stayed with me this far, there are 6 things I want you to remember. First, not ejaculating does not automatically mean something is wrong. Some men simply become less sexually active, and if they're comfortable and have no concerning symptoms, that may not be a medical problem. Second, sperm does not simply accumulate forever. Your reproductive system has natural ways of managing older sperm cells. You are not a storage tank that needs regular emptying. Third, ejaculation, orgasm, erection, and sexual desire are not the same thing. They work together, but one can change while the others remain relatively normal. Understanding that difference can prevent a lot of unnecessary worry. Fourth, there is no universally required ejaculation schedule. You don't need to follow an arbitrary number just because someone online claims it will protect your testosterone, prostate, or masculinity. Fifth, a sudden or unexplained change deserves attention. If your sexual function changes noticeably, especially after starting a medication or experiencing another health change, it's reasonable to discuss it with your healthcare professional. And sixth, don't ignore important symptoms. Pain, blood in the urine or semen, major urinary changes, or persistent unexplained sexual dysfunction should be evaluated rather than simply blamed on age. So, what happens when you stop ejaculating after 60? Now the answer should be much clearer. Your body has natural mechanisms for managing reproductive cells and fluids. Sexual function can change for many different reasons, and there isn't one experience that every man must have. The most important question isn't simply, how often am I ejaculating? It's, has something meaningfully changed in my body, and am I experiencing any symptoms that deserve attention? That shift from counting ejaculations to understanding your overall health is the real takeaway. But there is one final message I want every man watching this to take away. If you've noticed that things aren't the same as they were at 30 or 40, that doesn't automatically mean your body is failing you. Your body has changed. That's part of getting older. But change does not mean failure. Turning 60 does not mean your sexual health has an expiration date. You may experience changes in desire, erections, sensation, or ejaculation, but there is still plenty you can do to understand those changes and support your overall health. And please, don't feel embarrassed about bringing sexual concerns to your doctor. Doctors hear these questions all the time. What may feel deeply personal or uncomfortable to you is simply another part of a medical conversation. Being honest about a change can sometimes help uncover something treatable, identify a medication effect, or simply give you reassurance that what you're experiencing is normal for you. The important thing is not to measure yourself against another man your age. You don't need to prove that you're still 30. You don't need to chase an arbitrary ejaculation number. And you don't need to define your health by sexual performance alone. Intimacy can mean many things: affection, closeness, communication, pleasure, trust, companionship, and feeling connected to someone you care about. So, if something has changed, don't panic. Pay attention, ask questions, and when appropriate, talk with a healthcare professional. If this video helped answer a question you may have been uncomfortable asking, consider giving it a like. And if you want more calm, evidence-aware information about healthy aging, subscribe to the channel. You can also leave a comment with a general health topic you'd like me to explain in a future video. You never need to share private details. Remember, the goal after 60 isn't to prove that you're still 30. It's to understand your body, protect your health, maintain your confidence, and make the most of the years ahead.